Let's take a look at what is in my hospital bag. Hi everyone, it's Natalie. Welcome to today's video. We are going to take a look at what is in my hospital bag this time. I am 36 weeks pregnant right now. I've had this bag packed for about a week, and I'm super excited to share with you what is in here. If you want to see my last What's in My Hospital Bag video, I will leave that linked below. I'm a second or third time mom. This is my third baby, but I had twins in my last pregnancy, so it's the second time that I have put together a hospital bag, and if you want the comparison, then go check out that video. If you are new here because you have been browsing through hospital bag videos here on YouTube, then welcome to my channel. I make lifestyle and mommy videos here every week, and make sure you're subscribed if you enjoy this sort of video. Next week I'm actually coming out with my What's in My Baby's Hospital Bag video, and there's a really fun giveaway at the end of that video, and so I don't want you to miss out on that. So make sure you have the post notifications turned on as well. In addition to what is going in this bag, I have a couple of other bags that I will be bringing along that I just want to tell you about really quickly. So of course my husband is going to be packing a bag for himself, and we're going to have a bag for all of our electronics, our cameras, their batteries, SD cards, iPhone chargers, laptop, its charger. We're vloggers, so it's really important that we have that all put together because we don't want to miss out on an opportunity to get some good shots, and we will be vlogging the birth. So make sure you head over to my weekly vlogging channel, Nat and Wes and the Rest, where we will be documenting the birth. We're also bringing, I should say, a bag of snacks, so dried fruits and nuts and granola bars, some fresh fruit too, maybe some like juice packs and coconut water and that sort of a thing. Food is provided for me, but not for anyone else, so I want to make sure that my husband or anyone else on my birth team are fed. So let's talk about the bag itself. This is a Merona Weekender bag that I got on a buy one get one 50% off sale at Target. I also picked up a bag for my husband and then a couple of bags for us. So what's going into this bag is a series of other little bags, and I'm going to go through each one for you right now. So first of all, we just have a basic Toiletries bag. This isn't really a toiletry, but I didn't think of any other place to put these. Just a couple of tennis balls for pressure points and massaging. Weston can work magic with these on my back during labor and on my hips, and I found these to be really helpful the last time that I was in labor, so definitely bringing these along. And then we just have our basic shower supplies. I really liked being able to take a shower in the hospital after I was done giving birth last time. It made me feel much more fresh and clean. I just decanted some shampoo and conditioner into little like travel size bottles. I just have a facial toner, it's apple cider vinegar. And then in here I also have a little DIY. This is for postpartum. They in the hospital give you this, I'm trying to remember the name of the spray, but it's aerosol, it's full of chemicals. And I remember wishing that I had something a little bit more natural, so this is Mama Spray, and it's for down there after a vaginal birth, and it just helps soothe and heal. And this is just witch hazel, a blend of essential oils, and aloe vera. Honestly, my frame of mind is if this works just fine, then I won't go the mainstream route, but if the mainstream route, like the spray that they provide in the hospital, does a better job of relieving the pain, then I'll go for the best pain relief, because it's no joke recovering from that sort of a birth. I've had a C-section before and a vaginal birth, so I'm kind of trying to prepare for both case scenarios. Of course, toothbrush and toothpaste are included in here, and I have it in a little baggie in case any of these things break or leak. It'll all be contained and not get everything else messy. Just a couple of other basic things. I have dry shampoo, which is good if I don't want to necessarily wash my hair when I take a shower. I will have that on hand, a little disposable razor, a hairbrush, some Q-tips and cotton pads, and then I have this face cloth which just needs water on it to wipe makeup off. It's one of those like magic makeup wipe cloths. I love these things, so I'm definitely bringing one of those along. And I have a little manicure set because hangnails and that sort of thing really drive me crazy. Bobby pins and hair ties, and then I have homemade deodorant. I do make a lot of my own like DIY skincare hygiene products, like you saw that mama spray that I had. I've been making my own homemade deodorant for over a year now. You will see a couple of these items that I've made myself that I'm bringing. We're on to the next little bag, which is just a small bag of just a couple of cosmetics. One of the things I was really glad to have in my last labor and delivery was just a little selection of makeup. It made me feel more at home, it made me feel fresher and prettier, and I was glad that I had it, even though I may not use it this time. I'm just bringing just the bare essentials here. So first of all, I have Tarte Shape Tape Concealer in case I have any dark circles or breakouts. It's a very hormonal time. To add a little bit of color to my face, this IT Cosmetics Face Trio, which is just a blush, bronzer, and highlighter. I can do a little bit of eyeshadow with this. Of course, I can use blush and bronzer and highlighter on the other parts of my face. It's got a nice big mirror so I can put my whole makeup on by using this little palette, and it's just really versatile. And then it doesn't matter what sort of makeup day I'm having, if it's a I'm in labor, get out of my face makeup day or full glam, I always fill in my eyebrows. And so I have this L'Oreal Brow Stylist Definer pencil. Last two things in here is a little travel size Tarte Lights Camera Lashes mascara. I have a waterproof version coming in the mail. Hopefully it'll get here before the baby does, because I know there'll be some tears, and so I want to give myself a waterproof option as well. And then I just have this LA Colors Chunky Lip Pencil. It's kind of like a balm stick. It adds really nice color. And by the way, the makeup I'm wearing today was put solely together from just these items that I showed you. So it is possible to have a fresh face with just a couple of makeup items, and I think this is going to be all that I need if I even wear this much. Next little bag I have here, and this is something that I packed last time and was very glad that I had, is just a little kit of essential oils. Anytime I mention essential oils, I do have to give a disclaimer. I personally have been cleared by my doctor to use the oils that I'm going to show you, but if you want to use essential oils, then absolutely talk to your healthcare provider, doctor, midwife, whoever is giving you care, to see if it's the right choice for you. First off is my lavender. I loved this when I was giving birth last time. It's very calming and soothing, and hospital smells, birth smells, it can get kind of nasty in there. Having lavender on hand really helps to just freshen up the environment and make it smell nice and be calming, and so I've been cleared to use this one. In our electronics bag, like I mentioned before, we will be bringing our essential oils diffuser. I actually have it back behind me on my nightstand. And so I'll have this going in the room during that process. Another essential oil that I'm bringing along is one that I believe made a big difference during my labor last time, and that's clary sage. Now I have to be careful right now because smelling clary sage coming into contact with the oil actually can kickstart labor. And I'm already having contractions pretty regularly at this point, and so I definitely don't want that to happen. So without kicking myself into high gear here, I will just quickly highlight this clary sage. It really, I believe, made a difference last time, and so I'm bringing that along too to apply topically as well as put in my diffuser when I'm in labor. I'm bringing peppermint along for any tummy troubles. Now, once baby is born, I shouldn't use this anymore because it can inhibit milk supply, but I'm also packing this for my husband. So if there's any nausea or tummy troubles or whatever, peppermint is always a great one to go to for that sort of a thing. I have all of this packed in this tiny little zipper bag, and that's going in there. This is my breastfeeding bag. So I have, first of all, a reusable pre-fold diaper. We use these as burp rags. There's no pretty pattern or design on this that is going to get all destroyed if it gets stained, so that's why I like to use these for burp rags. And then I have some of these just disposable breast pads. I'm a leaker like crazy, you guys, and I have some reusable ones that I will come home and use. But when I'm out in public or in the hospital, I like to just have the disposable ones. I feel like they do work better. Also in this bag, I have a quick granola bar because I'm one of those people when I start nursing or when I even start thinking about nursing sometimes, I'm immediately starving. And so there's just something quickly to eat. And then I have the supplement fenugreek. This was awesome when my milk was coming in with the boys. I got my milk within 12 hours. Last time, it may have been because I gave birth to 2 babies, or it may just be my body, how it works, and I think fenugreek is an awesome way to support a healthy milk supply. So I'm bringing that along. My doctor has approved that. Got some hand sanitizer so I make sure I'm germ-free when I start getting baby on the breast. And then I have some homemade DIY nipple balm. I never needed nipple balm in my last breastfeeding experience. I've heard horror stories of chapped, bleeding, cracked, horrible things happening, and I just want to have this on hand in case that's what I experience. But a lot of the nipple balms that you can just get at the drugstore contain a lot of ingredients that I'm just not okay putting in a very sensitive area, especially an area that my baby's mouth is going to be on. So this is just all organic shea, coconut oil, cocoa butter, and a little bit of beeswax just to keep it nice and solid. So that's going in there too, and that is what makes up my breastfeeding bag. I've got a big airplane going on overhead. Sorry about the noise. Okay, so I'm going to move on to the clothing that I'm bringing with me. So I have a pair of cozy socks, some grippy bottom slippers. I have a pair of flip-flops right down there on the floor, and I'm a little bit too lazy to bend over and pick them up. I'm bringing flip-flops with me, just so you know. Any shoes that I wear is whatever I throw on my feet when I'm walking out the door, when I know it's go time and I'm headed to the hospital, which will probably be a pair of Toms. Those pretty much are the only things that fit me right now with the swollen pregnancy feet, and that will obviously be what I wear home. I couldn't help myself. This time around, I am bringing my own little labor gown. I wasn't allowed to do this in the last hospital that I gave birth at. When you give birth to twins, you're automatically in the operating room because of the high chance of a C-section, and they wanted me to wear just their hospital-issued stuff, but that's not the case this time. I am going to be attempting a VBAC, which I'm really happy about. So I am wearing a gownie, and these have snaps here for access to IVs and after baby is born so she can start breastfeeding. There's snaps in the back. It's not necessary, but I wanted to give myself the option, especially since hundreds of other women have worn those hospital gowns, and they're really scratchy and uncomfortable, and this one is nice and soft. In addition to that, I have a old worn out bathrobe. I've had this thing since Weston and I got married, and this is just in case I get a little bit chilly or want to cover up my arms. If it gets gross and dirty, if it gets thrown away accidentally, it's not really that big of a deal. But I do have a fancier robe. This one actually, Pink Blush Maternity sent this gorgeous little robe to me, and this will not be worn during labor and delivery. It's way too nice for that. This is more like a nursing robe, so after she's born and I'm cleaned up and we're bonding together and starting to nurse, or when I'm receiving guests, you know, friends and family to the hospital afterwards, I'll be able to put something pretty on. I think this will look pretty for any pictures or vlogging that we do. Thank you, Pink Blush Maternity, for sending this to me. It's very sweet. I will leave a link in the description box to this robe so you can check it out for yourself. Speaking of nursing, I have a generous little pile of nursing wear that I'm gonna bring. Couple of little nursing bras here. So this one is a Lamaze bra. It's got the cross front that you can just open for easy access. And then I have this one from Target, Gilligan and O'Malley's, just basic black with the little snap, open for easy access. And actually, I prefer nursing camisoles, like the tanks, to bras, but I'm bringing those just in case. I have a couple of tanks here, a little purpley one, and a black one, and I've got this little gray one with the buttons in the front. I thought that was cute. And I'm a wholehearted believer in clothing that is made specifically for nursing, because I just feel like it makes it easier. Now, one of the things I learned from last time was that buying underwear that's like 3 sizes too big and like granny panties, it was not effective for me because I had my babies and it was just too big. I don't know why I ended up getting such huge underwear. So this time I got underwear that will actually fit me. I've tried these on. And it actually has this reinforced panel in here to help keep a pad in place, and it's waterproof so it's not going to leak through. These are like specifically made for the female time of the month or postpartum, and I got a 3-pack from Amazon and threw them in the washing machine, and now they're ready to go for when I am postpartum and dealing with all of that. And so I have a few pairs of those in addition to a couple of pairs of just normal underwear in case I want to go that route. I have a couple of maternity leggings. I want to be able to pull that band over my belly. I realized right after I give birth, I'm still probably going to have a tummy that sticks out like I'm 6 months pregnant, and so I am still bringing maternity clothing with me for postpartum. And speaking of which, I am bringing a pair of my favorite maternity jeans with the full panel. This is probably what I'm going to be wearing home. And depending on the day, it's going to be in late April, so I don't know if it's going to be a totally sunny and warm day or a totally rainy and freezing day. It just really depends here in the Pacific Northwest. So my first choice is this Jessica Simpson. I bought this secondhand off of the Mercari app. It's actually a nursing shirt. It's got this cute little lace. It's 3/4 sleeves, and then it opens here in the front for nursing, which I thought was pretty cool. I've never had one of these sort of shirts before. And then I just have a short sleeve shirt in case it's like a sunnier day. Just a short sleeve V-neck for nursing, longer. This is a maternity shirt that I can put with those jeans. I've got a headband to keep my hair back and a couple of little eye masks for just making it nice and dark. I need a really dark room to sleep well, and so I'm bringing one for me and one for Weston because I know he's the same way. And then the very last thing, I should have probably started with this because it's kind of boring, but it's really important to me, is my file folder. I brought this last time. I was so glad that I had it. This contains insurance information, my will, God forbid anything bad happen, my medical history record, surgical report from the C-section that I had in my last birth, as well as this very special piece of paper saying that I have been cleared by the hospital I'm delivering at, by the team of OBs there, to attempt a vaginal birth after a C-section. In the extra pockets, I will put any of the literature that the doctors give me on my way home, Social Security, birth certificate information for the baby, anything that the lactation consultants, handouts, pamphlets, that sort of a thing, will all go into here, and it'll be contained in one place. So when I get home, I have a quick reference point to go back and get all that stuff. And as you can see, everything fits pretty nicely here in this bag. This is going by my front door, and it will stay there until it is time to load up and go to the hospital. There are some things that we will throw in last minute because we're vloggers. I use my cameras every day, and so those things will be thrown in last minute, but I have like a list on the door saying, don't forget, if you're on your way to the hospital, make sure that these things are packed and ready to go before you leave. Especially if I go into labor away from home and have to go straight from wherever I'm at to the hospital before coming here. Whoever is here, like my husband or my mom, they will be able to reference that list on the door and just throw whatever I need into the bag and pack it up for me and come meet me at the hospital. I'm getting so excited about this, you guys. Give this video a thumbs up if you enjoyed it, and subscribe to my channel for more mommy and lifestyle videos. Thank you so much for watching today's video, and I will catch you in my next one. That's all I need.
Yay.
Thank you.
Yeah.